Right, good morning everybody. Yeah, you're all very, very welcome. This is our second conference or Zoom call, should we say, for ILFA this year. And I'm more than happy to take part and hope that it will be of benefit to you all. We hope the technology will be kind to us and help us to connect with you. All going well. We have a great panel of clinical experts lined up, and I hope that you will enjoy all of their presentations. We also have two fundraisers who have achieved amazing fundraising goals for ILFA in 2020, which is remarkable given the year that has been, yes. ILFA is enormously grateful to our fundraisers, our supporters, and those who make donations to the charity and to keep us going. This year, ILFA received government funding from PUBL, and this has helped to support us throughout the year, a year that has never been seen before. PUBL funding is supporting today's event. The running order of our speakers this morning is Dr. Michael Henry, Carmel McInerney, Laura Grehan, and we will then take a 5-minute comfort break. Resuming, we will have Debbie Gibbons, Sandra Murphy, and Gerry Redican. Questions, if time permitted, will be via a chat function on our screens. Carmel is a clinical specialist at Ennis Hospital in Clare and works closely with the colleagues in Limerick University Hospital. Carmel is another great supporter of ILFA and has helped set up a Limerick IPF support group and has also helped to raise awareness for IPF by appearing on RTE for a makeover when nominated by Michael Collins, leader of the Limerick IPF support group. We are delighted that Carmel has agreed to speak to you today. I'll hand over to you now, Carmel. Thank you.
Morning everybody, and you're all very welcome today, and I suppose to say thanks to ILFA and to Gemma and Nicola for inviting me to speak today. And yeah, it's wonderful to be like an ambassador for ILFA and for the IPF patients, and I've just been recently appointed as an A&P in Ennis now, so it's good, and it's great to see the Clare support group up and running. So I'll start with the symptom management of a patient living with pulmonary fibrosis. Okay, so I'm sure you all know what IPF means, but just an overview again. Idiopathic means the cause is unknown, and pulmonary relates to the lungs. Fibrosis then is an increase in scar tissue, and it is a serious lung condition which makes it harder for you to breathe as the lungs become stiffened and thick and scarred. Okay, so the impact of pulmonary fibrosis on the quality of life, and these are the three symptoms that have the greatest impact on your quality of life, which is shortness of breath or dyspnea, as you might read in the books, cough, which can be debilitating and violent and exhausting, and it can cause nausea and exhaustion and sleep disruption. And anybody knows that anybody that has a cough, it does actually like keep you awake at night, and which brings on to the next symptom, which is tiredness or fatigue, and that can be overwhelming, because then you have a persistent lack of energy, exhausted even after a full night's sleep, on top of the breathlessness and the cough. And patients need to economize their energy during the day to help them overcome this tiredness. So, and these are the other symptoms that it can affect on your quality of life. Then would be pain. You can have headaches, chest pain, or tightness in your chest. Again, all related to your difficulty of breathing. Stomach issues. Acid reflux, there's a big incident with acid reflux and pulmonary fibrosis, and again that can cause irritation to your throat and your voice box, and again cause further coughing. And then anxiety and depression, because feeling of anxiety and panic after episodes of shortness of breathing or coughing, and then again the anxiety and depression in relation to what the future holds for you with this condition. And again, the physical impact on your condition, and can make daily activities such as showering and cleaning, housework, continuing with your hobbies that you used to do before you got this disease, and managing work and career. And that can all be, lead to emotional impact. People, patients are embarrassed about coughing with supplemental oxygen therapy. Then you have the social isolation, and that's even more compounded now with COVID-19 as well. We're now not meeting as many people and we're scared. So you have that social isolation. And then your decreased ability to interact with others. And that would have been in normal times. And now and again, it's further exacerbated with the COVID-19 restrictions. Okay, so we're just going to address some lifestyle changes, managing the breathlessness, the importance of staying active with pulmonary rehab or with just exercises, managing some of the comorbidities or the other diseases that are attached, and assessing benefits and support. Okay, so we'll talk a little bit about breathlessness. So breathlessness can be a distressing symptom because simple tasks become much more difficult than what you were used to when you get this diagnosis, like such as even just climbing the set of stairs. So I suppose one of the tips is to plan your daily tasks to avoid undue exertion. So you plan your activities around your breathlessness. So you break up that journey during the day. So you might have your shower and then take a break and then continue on maybe in a little while to do your next part of your daily activity, whether it's going for a walk or whether it's baking bread for some people, or whatever exercise they want to do. So breathing exercise, and that's really, really important. And I suppose most of you might be linked in with a physiotherapy, but like the ILFA website have a fantastic stall breathing exercises card, which goes through the breathing exercises which help you to like stop, take a break, kind of catch your breath, and purse lip breathing. You might have heard those words linked in through the physiotherapist. Breathing exercises are very, very important. Pulmonary rehab programs are extremely, extremely valuable. Like I suppose pulmonary rehab programs have changed over the course of the time, especially with COVID. Like we used to be able to run programs in Ennis and Limerick all the time with 10 patients in a room, but now that's gone virtual. So, and I'm sure you're aware that you can link into ILFA on a Monday morning at 11 o'clock to join these virtual exercise classes, which will help you. And these all help to coping skills to do with breathlessness. And also the fan that ILFA have is fantastic. We did it with our pulmonary rehab group about 2 years ago when we had pulmonary fibrosis group, and most of the patients found it so beneficial. It's a tiny little fan. You turn it on and it just helps with the breathing and helps you to cool down. And oxygen therapy, if you're using oxygen therapy, it's really, really important that you use your supplemental oxygen therapy during your exercises. And this will help you overcome the breathlessness as well. The cough associated with pulmonary fibrosis can be extremely debilitating. It's a dry, hacking cough. It's embarrassing. And certainly now in COVID times, there's even probably more people are more conscious of the fact that they have a cough. So it needs to be managed to reduce its impact on your physical and emotional well-being. And it's very easy to trigger that cough. It can be triggered by just talking, eating, laughing, or exercising. So these are just a few tips to help you with your cough. So drinking fluids to keep your throat moist, especially hot tea or honey. Some people associate honey like with soothing the back of the throat. Taking your time when you're exercising, and if you do start coughing, to stop exercising. Avoid the trigger factors that can trigger the cough, like smoking, perfume, household cleaning agents. They all impact on your cough. So if you can avoid those trigger factors, then it really, really helps. Acid reflux medication, there's a big link between acid reflux and heartburn and a cough. And especially if you're on antifibrotic medication, you really should be on an anti-reflux medication, such as brand names like Zofran, Protium, and they will help settle the cough. And again, deep breathing techniques are really, really helpful with the cough. And again, the physiotherapist can help with your respiratory nurse or during the exercise classes. And speech therapy, helping patients to speak more slowly, can also help with the cough. The fatigue or the tiredness, and we all know what it's like to be tired and fatigued, and it does impact on your daily activities. Even if you've had a good night's sleep, you're still tired. Between the breathlessness and the cough, you can be still tired. And I suppose one of the main things is, like, and I suppose as Irish people, we're very slow to ask for help. It's really, really important to ask for help, from another family member, a carer, a neighbour, or a friend. And especially in these times, because, with restricted movements, going into shops and doing grocery shopping, it's really, really important to ask for help. Somebody to do your grocery shopping, somebody to do your cleaning, because again, then you're saving your energy for maybe the things you want to do, like go for your exercise or round golf, whatever your hobby is. Exercise within limitations as well, you know, don't be trying to do too much exercise. And again, break up the exercise into smaller amounts more frequently. Nutritious food. It's very, very important, we'll say, with your food, that you're eating nutritious food, because like giving nutritious food or taking nutritious food means you're actually kind of increasing your energy. And Boring or Ingelheim, I talked to Gemma afterwards, they have a fabulous book out, and it's actually called Making Every Mouthful Count. It's especially for patients with pulmonary fibrosis, and it gives really, really, really good tips. So Gemma, I might talk to you afterwards about how we can get that out to the pulmonary patients. And again, pulmonary rehab, and I know I'm saying exercise might cause tiredness, but also exercise, it does give you more energy, and you learn loads like during the exercise classes on how to conserve your energy and kind of rejuvenate some of your tiredness. And plenty of rest and take naps. Don't be afraid to say, I need to settle down, I need to sleep here for a half an hour. So you take rest when you feel like it. And again, oxygen therapy helps with that tiredness, because it's giving oxygen to the rest of your body. So it does help with the tiredness. Pain and anxiety are symptom management, also called palliative care. And I know when we hear the word palliative care that we kind of tend to get frightened, but now we're kind of changing the name to symptom management, which is really, really important. And like, I suppose historically we were very, very slow to ask palliative care team to get involved. Whereas now I think we're much more open to the idea when it's called symptom management. You know, I very recently had a patient in Ennis that was really suffering with symptoms with breathlessness, and we introduced the idea of palliative care, I'd say maybe 3 months before the patient was willing to take it on. And he later told me it was the best intervention he had during nearly his whole journey through pulmonary fibrosis, because they were actually able to call to his house. His movement was very limited, but it was his breathlessness that he really suffered with. And when palliative care got involved, they were actually able to give him medication to help his breathlessness. He was still able to interact with his family. And then, like, closer to the end of his journey, the palliative care team were actually calling to his house, and he had gotten to know them, the physiotherapist and the palliative care nurse. So he actually thought it was a wonderful journey to have palliative care involved. So the palliative care is designed to ensure that you are comfortable by relieving pain and addressing other issues not directly associated with pulmonary fibrosis. And an example where palliative care can help include home visits by the nurse and physiotherapist. And, you know, physiotherapists can do breathing exercises, breathing techniques, and also make like little adaptations to your house that might suit you, your breathlessness, or the symptom that's causing you the most pain. Mouth dryness associated with oxygen treatments. They can help with special medication to alleviate the breathlessness, and help with medication to improve your appetite as well. You know, so they're a wonderful, wonderful service, like to have them involved in your care if you need them. Tummy issues or gastrointestinal issues. And again, antifibrotic medication, if you're on it, like pirfenidone or Ofev for your treatment of pulmonary fibrosis, can cause gastrointestinal issues or stomach issues. So it's really, really important to ask your doctor or your respiratory care team about medication to help increase your appetite, because with the work of breathing and maybe not being able to eat large amounts, sometimes your weight can drop. So it's really, really important to, you know, maybe take some vitamins or ask your respiratory team or your GP about getting medication to increase your appetite. Take your medication with the meal, or as instructed, I should have put in there, because like taking your medication on an empty stomach can actually further exacerbate your tummy issues, like if you have any nausea or vomiting. Take a walk before you eat sometime, maybe just a little bit of exercise around the house, small little exercise, because it kind of increase your appetite and help kind of empty out the tummy. Eat several small meals throughout the day as opposed to big, large meals, because like with your lung capacity, if you eat big meals, like it can actually reduce the space of your lungs and make it actually more difficult for you to breathe. So small snacks throughout the day, like, you know, I'm not a dietitian, but I know I heard a dietitian one day at Pulmonary Rehab talking about like beans on toast, like, you know, little bits of protein and a bit of carbohydrate, tuna fish, small little things like that are really, really nutritious and helpful, and you're building back up your protein and you're getting your carbohydrate. And if you are on medication, for your pulmonary fibrosis, it's really important, like, to talk to the doctor about lowering the dose if you're unable to tolerate the maximum dose, and that the side effects are really affecting your quality of life, to reduce the dose. Again, we had a lady very recently in Ennis that was on the maximum dose of the OFEV, and she had terrible tummy problems. And once we reduced the dose, she was actually able to tolerate it, and she's, you know, she's doing really, really well on the lower dose. So it's really important to talk to your team, either your GP again or the respiratory team, about the side effects. More little tips here for diarrhea, and again, that book, Making Every Mouthful Counts, is fantastic. And also ILFA have leaflets on their website, and I'm sure they're available to you, on eating and weight management, and they're really, really helpful. So if you have diarrhea, to avoid high fiber foods that are hard to digest because they're actually going to increase the diarrhea, eat bland foods such as toast and rice, small meals, and drinking plenty of water between your meals. And again, asking the doctor or your respiratory nurse about medications to help reduce the diarrhea. So it's really, really important to talk about your side effects, or if you have any issues with your tummy. Nausea or vomiting, and again, these can be related to, like, from the cough, from just the fact that you have pulmonary fibrosis, you can be prone to nausea or vomiting. So talk to your team again about prescription medication to ease the nausea. Eating bland foods, and drink peppermint tea, actually, or ginger tea or ginger ale is actually very, very good for like an upset tummy. Again, lifestyle changes that may allow you to feel in control of your disease and help alleviate your symptoms. And again, it's about improving the air quality and limit irritation to your lungs. So if you know the trigger is like going out, you know, if you know the trigger for your cough is going out, changing like warm environment indoors to going outdoors, then it's important, like, maybe to wrap up carefully before you go out, so that you don't notice the drop in temperature, and avoid complete irritation to your airways. Limiting the use of wood stoves and open fires, because they have a drying effect, and if you've always like a dry hacking cough, it just might exacerbate it another little bit. Removing dust regularly and promptly, and this is where asking for help comes in, and getting somebody to do your cleaning for you, and avoiding the dust, because again, dust is an irritant, so it does you know, it cause further cough or breathlessness. Limit the use of cleaning products that leaves fumes, and again, it's all the same thing, as, you know, they can irritate the lungs. Avoiding toiletries with strong fragrances, and avoiding you know, small little particles like flour or dust, wood dust in particular. The day-to-day living with activity is kind of like a vicious circle, if you know what I mean. So you have your healthy lifestyle, you know, like by going for your exercises, especially even just around the house. I know we can't go out much these days, either with the weather or with COVID, but just around the house is enough, really, you know. And again, I forgot to mention it earlier, ILFA have a fabulous step, you know, the 2000 step challenge, and again, that's available with a pedometer. So if you see that you're doing your 2000 steps, like, that's a really, really good positive movement, you know, for your to help live with your condition. You know, you can go out in the garden, you know, in your own garden, and that's keeping up your exercise. And then you lead on to your smoking. Like, anybody that's smoking should really, really consider stopping smoking. And again, there's loads of support available, because smoking does, you know, obviously can cause other conditions, but it does irritate your cough. It, you know, it will affect your pulmonary fibrosis. And there is, you know, help available on the National Quick Line for that. And again, the exercise, it's really, really important to keep exercise. And like I said, we have the ILFA virtual exercise classes every Monday at 11 o'clock. If you're in contact with any of your respiratory nurses or your respiratory team, we are running, most of the hospitals are running exercise programs, although they're virtual. So it's really important, like, they're all interlinked together, and like, if you can promote a healthy lifestyle, stop smoking, keep your exercise. Forgot to mention there, the flu jab is really, really important as well. And so you're making the best use of your time if you can do all that and improve your living then with your pulmonary fibrosis. And these are just some useful resources and websites, like the ILFA website. I mean, what can I say about them? They're just absolutely fantastic, like fantastic support for us as healthcare professionals in the hospital. Like, all we have to do is phone them and we get support for our patients. So it's fantastic. And support groups, I didn't mention it in there, but support groups, we have ours running up in Clare, and it's running up in Limerick, and they are around the country as well. And ILFA will give you the contact details. And I know we're all meeting virtual now, but it's really, really, it's really good, because you can share You can share the love, you can share the pain, you can share, and people share their experiences, and you learn so much from each other. And these are other organizations then as well that can help you. And that's it.
Thank you, Carmel. That was very good. Thank you for that presentation.
Thank you.
Yeah. I seen something on the screen there regarding an air purifier.
That's right, yeah. Just a question, does anyone have any recommendations, Eddie, or any of the panels have any recommendations for an air purifier?
Well, I've seen the Saline Plus one, the SALINS Plus. I don't know if there's any research behind them, but I do know a few of my asthmatic patients use them. They're about 100, maybe 150 euro. You plug them in, and they do say that they find them effective. But I'm not so sure there's any research behind them now. Maybe Dr. Henry might know more about that. But we don't advocate them all the time. Patients have come and asked, they've bought them, and they've said they've used them and found them helpful.
Right.
Okay.
Thanks
Eddie,
again, Carmel.
thanks, Eddie, and thanks, Carmel.
Word on Dr. Henry.
We're going to cross our fingers and toes. I know he had a couple of tech problems, but Dr. Michael is back again. So I'll just see, can he unmute there?
Anyway, so we participated in this large centre, 4 centres in Ireland, looking at patients who come into hospital during the COVID pandemic with severe pneumonia and how they did. And the answer is, if you do have IPF and you do end up getting severe pneumonia, the outcomes are not good. So I suppose the short answer is, realistically, try if at all possible to avoid it. And the best way to avoid it is I guess, the usual social distancing, etc. The good news, I suppose, is that we're not really seeing the number of more acute exacerbations of people's pulmonary fibrosis. So this is a CT scan of somebody with a viral exacerbation of pulmonary fibrosis. So anyway, this is kind of what happens during a standard exacerbation. And this is what happens in the winter. People with fibrosis get, even before COVID, viral flare-ups. And you can see this patient with a bad viral flare-up, their CT scan over a number of weeks just gets so much worse, and they can do really badly. The good news, as I say, is we're not seeing as many of these in the winter, and that's almost certainly because people with fibrosis are, avoiding social contact. So they're not getting the standard viral exacerbations. We're not seeing as many of them anecdotally as we do normally. Although, as I say, COVID exacerbations can be severe when they happen. Now, I haven't had a huge amount of patients. I think I've had 2 patients with IPF who've come into hospital during the COVID pandemic with a significant exacerbation, and they've both gone home. So it's not the end of the world, but better to avoid it. And the only way to avoid it really is to kind of keep as socially distanced as you can until we do have a vaccination. Again, this particular slide again shows what happens during an acute exacerbation. And after 5 weeks, this is a patient on the left. You see their CT scan. You can see all that honeycombing. It's like a crunchy, like I break a crunchy bar in two. And on the right, after 5 weeks of COVID-19, it's worse. So patients who do survive, if they get COVID-19, there's at least a strong possibility that they're going to be a little bit worse afterwards. But this is something that you guys might be interested in. It's the new phenomenon of patients who didn't have fibrosis, who get COVID-19 and get a severe pneumonia, or what we call an ARDS, and end up starting to develop pulmonary fibrosis. So we're going to have a new group of patients in the pulmonary fibrosis sphere who didn't have fibrosis before COVID, who got COVID. And as you can see on the 2 panels there on the top, that nice black CT, that black lungs look normal. After COVID, 3 or 4 weeks later, you can see all that sort of honeycombing with the arrow at the bottom. So it's a new phenomenon, and it's something we don't fully understand yet. We, along with lots of other groups, are starting to look at CT scans in patients who got COVID-19 to see how many patients are left with a scarring fibrotic picture afterwards. It's probably somewhere in the region of a couple of %, but it's definitely there. So moving on, what are the treatments we have? I'm sure all of you are interested to know, what are the treatments we have, effective treatments for COVID-19? The best treatment is not to get it, and I've covered that already. You'll all remember in the news, we all became, obsessed, and I'm still obsessed with Donald Trump. I'm going to miss him badly, actually. Just that the the daily news update from Donald Trump. And of course, Donald, as you all know, was a firm believer in Plaquenil for no apparent reason. Plaquenil was hydroxychloroquine, which was a rheumatoid drug. And of course, anything Donald said was unlikely to have any basis in reality. And it turned out when we finally did a trial on Plaquenil versus no Plaquenil, people who got Plaquenil actually did worse than people who got Plaquenil. So that's an example of giving a drug without any evidence. And that's really important. There's always a push to get things out as quickly as possible. And it's the same with the vaccines. And now we're starting to see good, solid evidence of vaccine efficacy coming through. So we'll all be safe in the new year. But that's why people want to get evidence before they give a drug without proper trials. So what drugs do we have that work? Well, in the early stages of the disease in Wuhan, the Chinese doctors started to give steroids to these severe COVID pneumonia patients, not with fibrosis, just COVID pneumonia patients, and they saw a reduced risk of death. So that was a small study, and you have to have follow-up studies. So the big follow-up study was in a drug called dexamethasone, which is a steroid tablet. And in patients who got severe COVID pneumonia, who were on ventilators or in hospital requiring oxygen, they showed a very significant reduction in death rate. So that's the first drug we have that works for patients with COVID pneumonia, whether they fibrosis or otherwise. The second drug we have that we know works is an antiviral drug. And now this is kind of standard of care for anybody who comes into hospital with COVID pneumonia, who's in hospital requiring oxygen or more, mechanical ventilation, etc. And the drug is called remdesivir. I'm sure you've all heard about it in the news or when you follow the literature, remdesivir. So this is not a cure. What this does is it's given over about 5 to 7 days, sometimes 10 days, but in around a week. It's a tablet. And it's given as either part of a trial, or now we can give it outside of a trial. We can just put you on the medication. And we showed that recovery time was better. In other words, you recovered quicker if you got this tablet, and mortality was a little bit lower in patients who got remdesivir. So we have 2 drugs now that we know work. We also know that patients who come in with COVID-19 often are prone to clotting. And they get clotting in their lungs and they get clotting in their hearts. And so sometimes we use anticoagulants like low molecular weight heparin injections, as some of you might be familiar. So we have a number of drugs now that we know work for patients, including fibrosis patients when they come in. Now you guys will all be familiar with these targeted antifibrotic drugs. And we heard in the last talk a little bit about pirfenidone and nintedanib, Ofev and Esbriet, or Esbriet and Ofev. So again, are these going to be of any use? So again, this is a young patient who got a COVID pneumonia. You can see on the left, he's got a little bit of gray sort of stuff on the sides. And then after a number of weeks, he's got that honeycombing, scarring, like a crunchy bar, fibrotic change. And it begs the question, will our antifibrotic drugs actually be any good for these patients who are starting to develop pulmonary fibrosis? And the answer is we don't know yet, but there now are trials of Ofev. This is a French trial. It hasn't reported yet, so we don't know for sure whether it's going to work or not. In patients who are developing pulmonary fibrosis, that these targeted antifibrotic drugs during these exacerbations may be effective. And so I suppose specifically for patients with pulmonary fibrosis, we know that Ofev is probably good in reducing viral exacerbations, and it may have some role in helping in patients with exacerbations or trying to reduce exacerbations in the COVID era and other viral exacerbations. But most important, I think, is general advice, social distancing. Things are opening up again now. I know that you as a group of patients are very aware of what your social distancing kind of needs are. You do need to exercise. You do need to try and get exercise, try and get out, keep your mental health going. That's critical for all of us, but it's most critical for patients with lung disease that they get exercise, as we heard in the last talk. But you've got to be as careful as you possibly can. I'm going to talk a little bit about patients who are on immunosuppressants. So apart from IPF patients, you can sort of see this is if you were to do a pie chart or a breakdown of all patients with pulmonary fibrosis, it'd be about maybe somewhere between 25 and 40% have IPF, but about 20% of patients have rheumatoid or other connective tissue diseases related pulmonary fibrosis, and sarcoidosis is another group of patients. And these are patients who are often on other immunosuppressants like steroids and Cellcept and rituximab and all these other drugs that some of you will be familiar with and some of you won't. So these are not the Ofev and nintedanib, they're the other drugs that a lot of you will be on. And the questions we get asked very frequently is, should I stop them? Should I reduce the dose? Should I increase the dose? If I get this disease, is it safe to start these drugs now? Or maybe I should just hold off until COVID has gone away? Well, we have some advice for you, both not my own advice, but from the American College of Rheumatology and the European version of same about the drugs that you're on. And if you're on an immunosuppressant, and drugs that you might be familiar, some of you like methotrexate or Cellcept, mycophenolate, or rituximab infusions that I would use quite a bit of, then we don't recommend reducing or stopping those medications during the COVID-19 era. It's not safe to do so, and there's no evidence that you're at a specifically increased risk. So keep your tablets going. Don't be afraid to keep your tablets going. You're much better off doing that than stopping. Steroids are slightly different. So steroids like prednisolone are slightly different. They do prolong the virus within you, if you like, or keep the virus alive for a little bit longer. So you are at slightly greater risk of infection than the other kind of drugs. So we try and get the steroid dose down to 10 milligrams or less during this particular pandemic. Most of you will not be on a dose higher than 10 milligrams anyway. But just for those of you who are, we're looking to try and get the dose down to 10 milligrams or less if possible. This is nintedanib or Ofev. And Ofev, for those of you who aren't aware, you know Ofev is a drug for IPF, or idiopathic pulmonary fibrosis, but there's now very good evidence that Ofev works in all the other fibrotic lung diseases like rheumatoid fibrosis or farmer's lung fibrosis or any other, the hypersensitive pigeon fancier's lung fibrosis or scleroderma fibrosis. It's just as effective a drug. The HSE, it's been given its go-ahead by the FDA and the European Medicines Agency. So the track for these drugs is you get evidence, then the medicine licensing agencies give it the go-ahead, and then it gets to Ireland, and then it gets halted by the HSE until eventually they agree to fund these drugs, because they're very expensive drugs, as you know. But hopefully in the next year or so, after the wrangling is over, these drugs will become available to you all in appropriate situations. And it is good, because once these drugs are being used in a much larger group of patients, the pressure is on the HSE then to take more notice of a larger group of patients and give us the kind of resources that we need for all fibrosis patients, and not just COPD and asthma patients, which is where the current HSE respiratory program nationwide is focusing its resources. So what have the challenges been to running a lung fibrosis service over the last number of months? Well, they've been huge, as you can imagine. They've been massive for you guys. They've been pretty big for us as well to try and provide a service. First of all, our pulmonary function labs closed down. And that's, as you can imagine, because blowing into machines and aerosol generating procedures, there's a huge concern that it might be infecting the staff, etc., etc. And there's national documents on that now, and the pulmonary function labs are starting to open again, but they're not working at anything near what they were working. And we needed those tests to be able to see how you were doing, what your progress was. So home spirometry and home testing is now going to be something that I think we're going to see more of in the coming years, probably. CT scanning, likewise, very difficult to get a CT scan done or catch up in the backlog. There's a backlog now at 12 months. So we're constantly up and down to the scanner, begging radiologists and radiographers to get scans done on you guys to try and tell us how people are going. Outpatients has been really challenging. So our outpatients here in the hospital was converted into a COVID stream, so it closed immediately. And we now do our outpatients in a local in a local convent beside a local school, about 500 meters from the from the hospital. So as I say, when we're heading across the clinic now, we're saying, are you off to church? That's where we go to do our clinics at this stage. And, you know, it's been wonderful to see everybody trying to get things going, but it's nothing like as effective as it was in the pre-COVID era. So remote phone and video consultations is going to be challenging, but very necessary. And I think that's the way forward anyway. So remote, so how do we do this? And is there any evidence to support remote monitoring of patients with pulmonary fibrosis? So this is called the Starliner study, and I don't want to bore you with data because I know you're not as tuned into that sort of stuff. But again, we here in Cork took part in this, and this paper has been published. So this is giving patients with pulmonary fibrosis a spirometer, this little machine up here, and a watch like a Fitbit that measures your walking distance. Got a bunch of these things in my office now, and we'll be starting to use these in the next week or two, where your data will come into us remotely, and we'll be able to connect with you and give you some advice, particularly if you're having problems. And there's lots of data on this in Ireland and Vincent's and the Mater and Beaumont and other places, and internationally, that this kind of system works. So it's patient empower. A lot of you will be familiar with this, I think. I'm only just getting familiar with this particular system, but we will be using this here and around Ireland, and it's funded over the next number of months to try and give you a better service. I won't dwell too much on what Rehab what's happened to Rehab, because the last talk did that very well, but obviously our rehab programs, like everywhere else, have gone from real rehab programs to virtual Zoom programs. But our physiotherapists have been diverted to COVID a lot of the time, so we're able to do less patients. But when we do get to do patients on virtual rehab programs, and this is just one of our physiotherapists has looked at this in the COVID, post-COVID virtual rehab, the experience has been excellent. You know, patients fantastic, very happy, enjoyed it, very motivated. It's a great option. And we measure things like breathlessness, and there's 12 classes over 6 weeks. So that's really something that's going to, again, I think help. And in the future, perhaps a blended face-to-face rehab and a virtual rehab going forward, even after the COVID-19 pandemic is over, will be something I hope that we will be able to do. And I know that Gemma, this is up on the website, and I know that Gordon and Paula in Limerick have done phenomenal work to keep an online COVID rehab program going virtually over the last number of months. And I have to say, huge credit and congratulations to them for doing that. So I'm sure you're all aware, and this is up on the ILFA website. Just a very brief talk about our pulmonary, our ILD, or Pulmonary Fibrosis Registry, and where we are with it. We have about 1,500 patients with fibrosis in Ireland, but we've never been able to measure how many we have, what they're on, how they're doing. And until you can look at this kind of resource properly, the government will ignore you. Also, we're able to look at people's outcomes. And the road to developing a registry in Ireland has been a long one, and it is currently stalled. So really, we set this up a number of years ago, a group of us, myself, Anto Regan, and Nicola, and others, to try and build a national registry. So we had good information about patients with pulmonary fibrosis in Ireland, and we struggled in a number of ways. Funding came from pharma. We didn't get government funding. We've never gotten government funding, despite meeting the minister. We have got other sites involved. We were able to look at various sites, but not every site managed to get involved. There was GDPR issues and overcoming ethics and funding and who was going to put the data on, etc. But when you do it, you know, you get good data. And we had lots of patients up to last year when this kind of stalled, and we were able to tell people, well, how are we doing compared to other countries? What are people's lung function like? Which groups of patients? For instance, here you can see this is a group of patients with very severe disease, moderately severe disease, and relatively mild disease. And we're able to kind of...
I think we're losing Michael's audio again there. Sorry, Michael, I think we've lost your audio again, if you can hear us. We did have a question on vitamin D, I believe, and loads of questions coming in at the moment. So hopefully we can address some of the questions while we wait for Michael to see can we get him back on there again. Does anyone, we had that question on vitamin D earlier on. Does anyone want to address that question?
Yeah, Justin, I'm happy to address that if you want.
Yeah, Sandra, please.
Yeah, it's actually a very timely question. So just this week, the Department of Health gave out guidance to advise all people over the age of 65 to take 15 milligrams or micrograms of vitamin D. So currently the Department of Health only give advice for children and to now adults over the age of 65 to take vitamin D.
Okay. Sorry, I had a question here from David, and maybe David, maybe Michael will want to address this separately with David McCurtain. He said, I'm due to undergo breathing tests prior to meeting Dr. Henry in mid-December. Will these tests go ahead? I don't know, Michael, have you got your audio back? Okay.
You hear me?
Yeah.
Yeah, we will be doing, what we've done is, and I'd say lots of other places are doing the same. So there is an NTPF, which is National Treatment Purchase Fund. We're looking to buy time in labs in other private hospitals a lot of the time. So we're sharing our pulmonary function testing between our lab here and our lab in the Mater Private Hospital and our lab in Mallow Hospital. So hopefully, yeah, we will be able to get your PFTs done. I think not everybody every time, but most people most of the time.
Great, thanks, Michael. Rachel Parrott says, I'm trying to improve my exercise by walking outside, but find the weather challenging. I really want to be outdoors when I'm walking. So should I push myself and just wear the best waterproof clothing I can, or should she take a rest? That's an open question to all the panels.
Take that if you want. So hi Rachel, my name's Debbie Gibbons. I'll be chatting in a little while about, I'm a physiotherapist, so I'll be talking about different exercises that you can do in the home, just because I'm very aware we're going into kind of November, December, January, where really Irish weather doesn't really allow us to exercise outside. Walking has so many benefits that are not just physical. So even for your mental health, walking outside, if that's something that you really enjoy, then I would encourage you to go for it. Just in relation to what Carmel was saying there earlier about maybe wrapping up warm to avoid that extreme changes in temperature for your cough. I suppose I don't know you personally, so I don't know what your balance is like, but if you are, in any way unsteady on the feet or a little bit wobbly, maybe, not going out when it's really, really windy, and being mindful in the rain and the ice that's going to be coming, just being mindful of slippy conditions and the leaves at the minute. But yeah, I mean, if it's cold and you really want to get out walking, I would recommend just hat and scarf and gloves and coat and go for it.
Thanks for that, Debbie. Paul asks, how much does the spirometry equipment cost and where can be sourced in Ireland today? Hopefully I pronounced that word right, spirometry equipment.
So, well, we will, as part of the program, as I say, the HSE is funding this. So we're getting these spirometers and pulse oximeters from a patient Empower down to us, and we're giving them to patients at the moment. So you hopefully, if you're linked in with a centre that's doing that, you won't have to buy it. If you decide to buy it one yourself, you can get them online. They can be anything up to 350, 400 these are little handheld ones. But if you're linked in with a centre that's using this, and you can ask your own consultant, you may be able to get them for free.
Thanks for that, Michael. Okay. There is other questions coming in. We are conscious of time as well, and we want to, so I'll move on there, Eddie, if that's okay.
Correct. Our next speaker is Laura Grehan. Laura is a phenomenal person. Not only is she a terrific athlete and fundraiser, she's also my niece. So Laura, I'm going to hand over to you now.
Thanks for the introduction, Eddie. It's great to see you, actually. We haven't seen each other in quite a while. I'm delighted to have been invited along today. It's been fascinating so far. And I was invited to share my experience of what it was like to cycle across Ireland in in aid of ILFA. So this was a mission that I completed in September of this year. And I know some of you will have read or maybe in the ILFA newsletter or have heard me speak already about the record attempt in previous work group meeting. So what I'm going to do today is to look on sorry, I just want to check that my screen is displaying okay.
Yeah, that's perfect now, Laura.
Okay, great. So what I wanted to do it was to go through the 10 things that I learned from cycling across Ireland. So number one, I guess for me, probably in some way should have been to kind of park your crazy dreams. But I really, when I first heard about the fact that there are records for cycling across the country, it was something that straight away I wanted to look and see, well, what is the current female record for cycling from west to east or east to west of Ireland? And I actually discovered that there were no female record holders of World Ultracycling, or Irish female record holders of World Ultracycling Association records. So straight away, this is something that I thought this would be a pretty cool thing to do. And what the challenge itself involved was cycling from, it was approximately 380 kilometres from the most westerly point in the country, which is Slea Head, just out past Dingle and County Kerry, right across 6 counties and 2 provinces, to bring me across the Wicklow Mountains and finally to the most easterly point of the country, which is at Wicklow Head Lighthouse. For me, all the way through the huge amount of training that it took, and during the record attempt itself, the key thing was to keep focused on why am I doing this, and there were 2 main reasons, I suppose. One was to see that it actually was an inspirational thing for a lot of younger females in particular, and I have photos there of 2 of my nieces who are kind of gone cycling crazy as a result. And also for not so young females. So, for example, I know that my own mother and also Nicola Cassidy, who's ILFA director and is my own cousin, has dusted off her own bike and got back in the saddle. So that was fantastic to see. And also a key inspiration or motivation for me was being able to do something to raise funds for ILFA in memory of my aunt and Nicola's mother, Denise Cassidy, who you see there. And Denise she sadly died of lung fibrosis in 2006. And she was an avid sportswoman and had a real sense of adventure and lust for life. So to be able to do something in memory of Denise, while also raising funds for ILFA, really was the inspiration behind it. So I found myself at 4:45 in the morning of 5th of September in complete darkness in the middle of rural Kerry, with the prospect of a full day's cycling ahead of me, 380 kilometres. Could have been extremely daunting, particularly because we opted to have an online tracker, so people were able to follow where I was at each point during the day, and to hopefully be able to see that I was still moving. And in the preparation for it, I often thought of, oh God, it's going to be kind of terrifying starting out. What if what if I fail? What if I'm not able to keep going? But actually, the night before the record attempt, I got a text from an experienced ultracyclist who I know, who said to me, listen, the most important thing tomorrow, you're actually going to perform best if you just go out there and enjoy it. And that's exactly what I did. So at no stage over the course of the day did I actually look and see, well, how far have I gone? How much further have I to go? It was just a case of keeping the wheels moving forward. And before I knew it, I was actually found myself in County Wicklow and nearly at the finish. I found pretty much straight away that, like lots of people were saying to me, how could you possibly cycle so far on your own? And actually the key thing is that it wasn't an individual